I'm Abigail Blackrick. Today I'm in Kingsley at the K-Town Youth Care Clinic speaking with Chris Rogan, Youth Advisory Supervisor for the Grand Traverse County area. Chris, what is the K-Town Youth Care Clinic?
K-Town Youth Care Clinic is an adolescent health center. We specialize in servicing clients 10 to 21 years old, and we'll also see the children of those adolescents as well.
And so with this clinic, it's a little bit different than some health clinics that are linked to schools and are actually based at the school. This one's linked and is about a mile away from the school.
Sure. Yeah, we are a school-linked clinic, and you're alluding to school-based clinics. Our clinic provides primary care services and behavioral health services. The primary difference between those two clinics is they can provide all the same primary care services and behavioral health, but we are able to, being off-site from the school, to provide birth control and family planning services for clients.
Terrific. So with being off the school, what went into that deciding process of saying we're going to be a school-linked clinic rather than a school-based clinic?
Yeah, so when the clinic was first thought of about 5-6 years ago now, a needs assessment was performed in the community, and we got with local schools, local community health department, parents, teachers, and everything, and asked them pretty much what they wanted in a clinic, whether it should be school-based or linked, and it came up, the decision made that this would be the best option for everybody.
Okay, so is it only available to students at Kingsley High School and Middle School, or is it youth in all of Grand Traverse County?
Sure. Our clinic is technically available to anybody 10 to 21. Our target audience is the Kingsley school system and those staff members or those patients and those students, but we will see anybody 10 to 21 in the 5-county region.
Oh, that's great. I feel like that's a little bit different than some of the school-based health clinics as well. And is it available only Monday through Friday? What are your hours?
Monday through Friday, 8:30 to 4:30. Appointments are requested, but we will see anybody even on a walk-in basis.
And what's your guys' policy on being able to pay for these services? Is it only if you have health insurance, or do you ever turn people away?
Yeah, absolutely. Nobody will be turned away regardless of ability to pay. We are a Medicaid sign-up site as well, so if somebody needs to sign up for insurance, they just don't have it, our staff is actually licensed to be able to help assist them with signing up for Medicaid services. We do also have a sliding fee scale as well, so if you don't have the money to pay for our low-cost services, number one, we're not going to turn you away, but number two, we will slide that scale based on your finances.
Great. So you said you are a service that can also help people sign up for Medicaid. With that, does that mean that once they can no longer come here, they've aged out or they moved out of the county, you guys will help them find service elsewhere?
Yeah, we do referral services. Once they age out of our clinic, so they hit the 22nd birthday, we can refer them to other services that provide similar services to us. And like I said, insurance, we will do that as well, help them sign up for insurance. So even before that point, if they need additional services, as in dental or vision services that we don't provide here, they are able to go utilize those services in the county.
Great. And what all services are offered here? I know there's a lab, so that's great. Is there really anything you don't do?
Not really. We're not going to do we don't have an x-ray machine to do that on site, but we do full acute minor illness, minor injury, full comprehensive physical exams, birth control, STI testing, pregnancy testing, and full behavioral health, mental health counseling services as well.
Being that you're off the school campus, is it difficult for students to come here for those services during the school day, perhaps?
It can be a challenge. High school students have a closed campus, so getting them off-site for confidential services that they might want to be able to attend our clinic for can be difficult. But we have a great relationship with the Kingsley school system to where the middle school, we will help walk them back and forth to school.
And so you said you have a great relationship with the school. How has just all around you guys, how have you worked together to make sure that the local students are able to get the best access to knowledge and services here in Grand Traverse County?
Sure. Yeah. So the school system allows us to come to assemblies with them and actually provide both regular anything, cyberbullying, bullying, texting, anything like that. We do assemblies there. We also work with the community outreach centers to provide services in those centers as well. The relationship with us has allowed us to increase attendance because healthy kids have better attendance and healthy kids actually perform better academically.
And Chris, is there a phone number that people can call if they need to visit this health clinic or if they just want more information?
Yeah, they can call our clinic here, 231-263-5895.
Perfect. Thank you so much.
Thank you.
In Grand Traverse County in Kingsley at the K-Town Youth Care Clinic, I'm Abigail Blackrick with My News 26.